Menopause is normal. Every woman with ovaries will go through it at some point in her life. Yet why is it so overlooked? Dr. Rajita Patil asked that very question, and she co-founded the first comprehensive women's menopause center here at UCLA in September of 2023. I hope you enjoy my conversation with Dr. Rajita Patil. Dr. Patil, how did you become involved in women's health?
Yeah, I actually didn't know that this is what I wanted to do for the longest time. But when I went through my residency, it completely sold me. The fact that I could see a woman through their entire reproductive lifespan was very attracting to me. And the fact that we can deliver their babies and we can help them through their contraception. And then, we get to menopause. And sort of the beginning and the end of this reproductive lifespan was really appealing to me. I think also just from a cultural standpoint, my mom is from India, and we really didn't have that dialogue where we could openly really talk about women's health or what's happening with me as I'm, going through these phases. And so I feel very passionate about providing that for my own daughters, but also just in general, we should be having open conversation and being able to provide that kind of care in an open way. And so that's what really gravitated me towards the field.
I love that so much. You co-founded the Comprehensive Menopause Center here at UCLA. Can you tell me how you went about doing that and what inspired you to do so?
Yeah. So, I've been practicing OBGYN since 2006 when I graduated from residency, and I've been providing the full scope of care. However, I felt very uncomfortable in the space of menopause. Even though I wanted desperately to provide that care, I didn't have the knowledge. And so about 5-6 years ago, I really started just having this desire to learn more. So I went and got a lot more training in it, went to a lot of conferences, just really learned a lot about it. And then I sort of had this aha moment on the plane home maybe 2.5 years ago, where I said, you know what, we have to do this better. Like, I am not alone. A lot of my colleagues and friends in this field, they don't know how to care for menopause, and that is just not right, as 50% of our population goes through it. So I had this aha moment, and I said, we're going to do this differently. We're going to start at UCLA, and this has to be done. So that's kind of where that inspiration came from. It's just my own not having that knowledge, and then wanting to now realize that we have to have other providers really learn. It's not just OBGYN providers, it's also our primary care colleagues. They also have a void in this knowledge. And so that's where it was inspired from.
What is a certified menopause physician, and how can a patient find one?
So a certified menopause physician in menopause, it is someone who's received certification after they've passed a examination showing that they are competent in menopause care, but they also understand the evidence-based guidelines and practice around that. And they're also committing to the continual learning in that space. And so that examination is given out by the Menopause Society. This is a wonderful society. It's made up of a lot of experts in the field and from all different disciplines, not just obstetrics and gynecology. There's primary care specialists, there's mental health specialists, so multidisciplinary. And so you can find menopause certified providers by going to their website, actually. They have a full list of who is certified in your state as well.
Oprah told us about her arrhythmia and how it was a symptom of menopause. What can you tell us about arrhythmias and menopause?
Yeah, number one, there are estrogen receptors in the entire body, and that includes the heart. One of the things we know about estrogen, which we know changes in menopause, there's a fluctuation that happens in that early stage, and then eventually the estrogen levels decline in the body. But we do know that it's very important in the signaling conduction pathways of the heartbeat. And so when that changes all of a sudden, and over time, also after menopause, we start to see things pop up like arrhythmias, and people start to feel heart palpitations, for example. We also know that it very much affects blood pressure, that we see the blood pressures tend to rise after the menopause transition or during the menopause transition. The stiffness of the arteries change, and so we start to see like cholesterol changing. And we start to see that the visceral fat around the body changes, like the fat around the organs. So all of these things affect the heart. And that's why we start to see more metabolic syndrome, and we start to see more arrhythmias and things sort of coming out when they weren't there before the menopause transition.
What happens when the body goes through menopause?
Well, it's not the same for everybody, but What we do know is that there is a fluctuation of hormones, and those hormones affect all the organ systems in the body, but they affect everybody differently based on predispositions and lifestyle practices that they may have and their health that's going on with them. We know that these can affect the brain, and so we see people have mood disturbances or cognition fog because of that and the way that the neurotransmitters are working in the brain. We see the things I mentioned about the heart and the fact that you might start to notice that your cholesterol is changing, your blood pressure is changing, you're pre-diabetic now, arrhythmias. We also see hot flashes. So that is something that happens when fluctuations of hormones are happening. That can be quite disturbing for patients. And then we also see sleep disturbance, and all of this is really related to the changes in the hormones that are happening quite suddenly, which is unlike men's aging, but it's just, different.
What is perimenopause and what is menopause?
One thing to know is that it's a clinical diagnosis. It's not really made from like a lab value, which I know there's a lot of misinformation out there. So I always want to mention that. Perimenopause is really defined by when your periods change, and so they're more irregular. So if you have a very regular period, maybe they're off by 7 days here and there, that's really the start of perimenopause. And then it can be associated with all of the symptoms I was mentioning. So the brain fog, the mental sort of health changes. You might experience some anxiety, some depressed symptoms, the hot flashes, the sleep disturbances. And so that is what perimenopause is, but it's really defined by the change in your period regularity. Now, menopause is actually a retrospective diagnosis. So it's actually like looking back and saying, oh, I haven't had a period for a whole year. Now we know you're in menopause. Now, I always want to say that sometimes you can have a period even after that 1 year mark, and we still need to see you to make sure we're not worrying about other things, but it's sometimes your ovaries just become active again, and that's normal.
So hormone replacement therapy, this is a hot topic. What can you tell us about it?
Okay. Well, there's a lot to say.
Yes.
I will say that it was the number one drug that was provided in the 1990s, 2000s. And then this study came out, which is the Women's Health Initiative in 2002, which really brought a lot of alarm and fear into prescribers, like physicians and practitioners, as well as patients, because it showed that hormone replacement therapy increases the risk of breast cancer, heart disease, and dementia. And it should not be used for primary prevention of those conditions. But really, that population that they looked at was patients that were over the age of 60. And they didn't really study the effects on younger patients and patients with menopausal symptoms. So I will say that at that point, hormone therapy was just like not available. And that is one of the reasons why there's a huge knowledge gap in this country around menopause, is because we weren't being trained in medical schools and residency programs because of that study. That's one big reason. But since then, we've really received a lot more data, and we've done further analysis of the data that's out there to really show that when we give hormone replacement therapy to younger patients in early menopause or perimenopause who are symptomatic especially, and who don't have existing heart disease or breast cancer, who don't have high-risk conditions, that actually that risk profile is very favorable, and we are not providing harm to them like we thought when we're giving it at an older age. So that's an important thing to know about hormone replacement therapy. It doesn't mean it's for everybody. It should be individualized, really. We need to know what is going on with the patient and what is going on with their health and their symptoms before we decide together, right, if it's the right thing for you.
I was told that younger women are protected from heart disease because of their hormones. What happens after menopause, and what should patients know?
So the natural body's estrogen, nothing can replace it. No bioidentical hormones that are out there can replace it. It's your natural body's estrogen. And we know that that estrogen is protective on almost every single organ in the body. So when that's lost, and it's lost very suddenly in menopause, it does affect every organ in the body. Not everybody has an adverse effect or a negative effect from it, but it definitely increases the propensity for things like cardiovascular disease in the future, for bone loss and osteoporosis, for cognition disturbance. It doesn't mean that you're going to get a chronic disease, but it just puts you at a little bit more risk.
Can you tell me about the correlation between hot flashes and heart disease?
So hot flashes I always like to say, are not just hot flashes. They really do signify some sort of an inflammation going on in the body. And the more hot flashes a person has, the more severe they are, the more intense they are, the more that they're disturbing your mood and your sleep, the more effect they have long-term on cardiovascular risk. We see a direct correlation between the severity and the duration of these hot flashes and cardiovascular disease in the future. So it's important to take those seriously.
I've heard you talk about lipoprotein A being a marker and an indicator of heart disease. What can you tell us about this test?
So lipoprotein A is something that's still being studied, but we know that it's a marker that sits on cholesterol. So it's traveling in the bloodstream just alongside some of the cholesterol, because there's many little proteins like this in the body. But what we know about lipoprotein A is that it can signify that there's a higher risk or propensity for cardiovascular disease in the future. So that, alongside genetics and lifestyle, how you practice, your diet, exercise, all of those things are really important to understand the ramifications or the effects on how to really risk stratify the lipoprotein A level. But if you have an elevated lipoprotein A, it does signify that you're at higher risk for cardiovascular disease. It shouldn't be the only thing that we're looking at. Like I said, we should really be looking at these other things also, like what is your cholesterol level? Are you pre-diabetic? What is your weight? Are we obese or overweight?
Should people have their physician check for lipoprotein A as opposed to their cholesterol levels, or what is the difference?
When we check a cholesterol, like a lipid panel, right, that's looking at all types of cholesterols. And so it's important to still get that information. However, lipoprotein A is a very specific little protein that's sitting on the cholesterol that can signify elevated cardiovascular risk. So it's not that we should be doing a lipoprotein A in lieu of cholesterol. However, it's a once in a lifetime check. It doesn't need to be checked more than once. And if you have an elevated lipoprotein A, you are at higher risk for cardiovascular disease in the future. So it's even more important to be looking at your cholesterol, to be looking at all the other risk factors for cardiovascular disease and optimizing those with a cardiologist or a primary care physician that feels comfortable addressing cholesterol, addressing your cardiovascular risk.
I coined the phrase heartquake or trauma of the heart. What does that phrase heartquake mean to you?
I like the word heartquake because I think, number one, the word earthquake makes us want to stop for a moment, think for a moment what's going on. It's a triggering word. And so I think that combining it with the word heart, it makes me want to think about the heart.
Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart healthy living. And remember, wellness starts with the heart.